how are ya? Today I'm going to try to convince you to stay home regardless of the governor opening our state by showing you some of the numbers and some of the concerns I have with the state opening back up. So, basically the White House has put out this 3-phase plan. Now, states are going to follow this at their own timeline based on conditions. So you've got, all 50 governors deciding what's safe for their state. And before you go through with any of the phases, you have to meet a gateway requirement, which is basically saying that for 14 days you have a downward trajectory of cases in your state, which I'd like to start off by saying has not happened in Georgia. So, Governor Kemp, even though this has not happened, has decided to prematurely open the state and begin phase 1. So, phase 1 is going to be vulnerable individuals are still staying home. So people with, if you have like diabetes, a liver disease, a heart disease, or, asthma, other immunocompromised people. So if you have HIV, AIDS, have undergone chemotherapy or an organ transplant, that's going to be you as well. And then they're saying that you can't have over 10 people in one area if you can't follow those physical distancing protocols, so that's 6 feet. And then also just in the place of work, if there's any where people like to congregate, break rooms and all that, have that shut down. There are some reopenings that are going to happen. So we're going to have restaurants, movie theaters, and sports venues if you can have strict physical distancing protocols. And this also applies to gyms, but they also have to adhere by strict sanitation protocols. But schools are going to remain closed. And also we're going to remain hospital visitation and senior living facility visitation. That's going to stay closed. And then, of course, just limiting all non-essential travel is going to be something. Now, phase 2, this is going to happen if during phase 1 you don't have any upward shoots, you don't have any rebound of the virus. So then you're going to move on to phase 2, which is going to be these vulnerable individuals remaining at home still. And the same with hospitals, senior care facilities. But now we're going to change it up a little. We're going to be able to have 50 people if you can practice that 6 feet social distancing, which is 40 more than phase 1. Schools can also reopen as well as bars, but they have to adhere with diminished standing room occupancy. And all those large social gatherings I was talking about before, so movie theaters, sports events, they're only going to have moderate physical distancing protocols and not the strict ones that were mentioned earlier. And phase 2 is also going to allow all this, it's going to allow resumed non-essential travel. So, you can go out and, go to the movies and all that. Phase 3, just to keep it simple, is if all goes well and, the virus is getting better, if your state operates with caution, you can return to basically normal. So, all of the details for this can be found on the White House's webpage, and they've got it really outlined there for, businesses and individuals, XYZ. And so now that we have a good understanding of this plan for recovery in the United States, I want to paint a picture of where Georgia specifically is at. Now, on April 20th, Governor Brian Kemp came out and he held this briefing to discuss his plans for the state of Georgia. Now, he starts by saying, "Today we are announcing plans to incrementally and safely reopen sectors of our economy." Now, to give more detail, this means, again, those gyms, bowling alleys, tattoo shops, barbers, nail salons, hair salons, and massage parlors will be able to open on April 20th, and then restaurants can have open dining spaces on April 27th. Now, this is where the issue comes in. You have to have this 14-day downward trajectory to begin with phase 1. However, we don't have that, but Kemp's beginning with phase 1. Now, according to this New York Times article, the president even steps in and he says it's too soon. That's the exact quote about Kemp's decision. Now, I have to agree, it's too soon. According to the Georgia Department of Public Health, they have this page, COVID-19 Daily Status Report, and the cumulative number of cases from February 1st to 7 o'clock this evening is how soon it's been updated, has continued to rise. So again, with that, no 14-day decline, but they're still reopening business. And then according to the CDC, the national curve, so the whole country, is going to continue to rise until mid-May, which is where their projections end. And then they also have state-by-state projections. And again, until mid-May, Georgia is slated to continue to rise. And then also there are some issues with Georgia's numbers too, so we don't think they're that high. However, the Harvard Global Institute is saying that tests should be about 150 per 100,000 people per day, but right now Georgia only has the resources to test about 40 people per 100,000 people per day, which is also significantly less than about all other 50 states. Well, 49, I suppose. So, as you can see, Georgia is just opening too early. We don't have low enough numbers, and they're not accurate, and this is going right against what the White House is saying. It's too soon, and it can be dangerous because we could have a spike in our numbers again and have to close for another 2 weeks and start this all over again. So in conclusion, Georgia is not following those White House recommendations, and they're clearly opening prematurely, which could lead to a second wave of this virus throughout our state. So please, despite these salons, these gyms, and restaurants being open, stay home. We can get takeout, exercise at home, go run on a trail, cut your own bangs, but please do not go out unnecessarily. Thank you.